Right now, there is probably a microscopic grain of grass pollen floating right into your nose.
Almost certainly.
And, in about 3 seconds, that tiny little speck of pollen is going to trigger this massive involuntary reflex, a sneeze that fundamentally tests the structural integrity of the deep muscles at the very base of your spine.
Which is wild to think about.
It really is. I mean, usually when we think about our bodies, we picture this neat, isolated hospital directory, right? Like
Yeah.
you have the respiratory clinic on the third floor dealing with the sneezes.
Right, and the urology department on the fourth floor for the bladder.
Exactly. And then orthopedics is somewhere down in the basement.
It's so comforting to imagine it that way. Just, treating the body as these totally disconnected compartments. It makes diagnosing things feel so much simpler.
Because if you have a runny nose, you just treat the nose.
Yeah. Or if you have a weak knee, you only look at the knee.
Hmm.
But the moment you actually step into the world of biomechanics and internal pressure,
Those neat little boxes just completely fall apart.
they absolutely do.
And that brings us to today. Welcome to today's custom-tailored deep dive. For those of you keeping track of the calendar, it is June 19th, 2026.
Right in the thick of peak grass pollen season.
The absolute worst time for it. And you've brought us a fascinating stack of sources today. I mean, we've got clinical guidelines, physical therapy blogs, some incredibly dense medical texts.
Very dense.
Yeah, but they're all pointing to this highly surprising medical intersection. We are investigating a very specific question for you today. Can chronic sneezing from allergies actually affect your pelvic floor support?
And the short answer is yes, absolutely.
But the mechanism behind that yes is, well, it involves a whole cascade of physics and biology that most people never even consider.
Exactly. Because it's not just a matter of saying, sneezing makes people leak.
Right. Our mission today is to really break down the hidden physics of a sneeze. We want to understand the massive downward force it creates.
And we're going to explore the specific biological and chemical reasons why the pelvic floor bears the brunt of all this allergy season trauma.
And then most crucially, we are going to extract the practical clinical techniques from your sources to actually protect your body from top to bottom.
So to really understand how a sneeze impacts the pelvis, we have to kind of strip away our basic assumptions about what the pelvic floor actually is.
Because people tend to visualize it as like a static hammock, right?
Just sort of passively hanging out down there between the hip bones. But according to the medical literature you provided, it's actually this highly dynamic, complex, U-shaped sling of deep muscles.
The levator ani group, right?
Yes, exactly. So you're looking at the pubococcygeus, the puborectalis, and the iliococcygeus. These muscles stretch all the way from the pubic bone at the front right back to your tailbone.
Wow.
And they actively encircle and support the bladder, the uterus, and the rectum.
Okay, so if we look at the actual anatomy of a sneeze, just the physics of it, all of that sudden air pressure has to go somewhere.
Right.
I mean, the diaphragm violently clamps down, the lungs compress. So is the pelvic floor basically acting as a shock absorber for the entire torso?
It is the primary shock absorber. The clinical term for this is intra-abdominal pressure, or IAP.
IAP, okay.
Think about the millisecond buildup of a sneeze.
Yeah.
You take a sharp inhale, right? Your glottis closes at the back of your throat, and your abdominal muscles just undergo this explosive involuntary contraction.
Because your airway is momentarily blocked.
Exactly.
Yeah.
Before the release, that contraction creates an immediate, massive spike in internal pressure. And since gravity is a constant downward vector,
That pressure wave just shoots straight down into those levator ani muscles.
like a hammer blow.
Well, one of the sources, Servu Health, actually uses this soda can analogy that perfectly illustrates this whole pressure system.
Oh, I love that analogy. It's an incredibly accurate visual for fluid dynamics within the body.
Right. So imagine your torso is a sealed, pressurized cylinder, like a full soda can.
Yeah.
The diaphragm, your main breathing muscle, forms the roof of the can. Your deep core muscles and your spinal stabilizers, they make up the sides. And the pelvic floor forms the base.
So every time you breathe, talk, laugh, or sneeze, the pressure inside that cylinder fluctuates.
But here's where my instinct kind of gets it wrong. If this physiological soda can is dealing with violent spikes in pressure from a sneeze, I would think the base needs to be totally rigid.
Like bracing a door against a storm.
Exactly. Like, shouldn't the pelvic floor be rock hard, just constantly clenched to resist all that force?
It's a logical thought, but that instinct is actually the source of a massive amount of pelvic dysfunction.
Wait, really?
Yeah, because a rigid base is a fragile base. The pelvic floor needs to behave much more like a trampoline.
Oh, interesting.
Think about it. If you pull a trampoline canvas perfectly taut and rigid, and then you drop a heavy bowling ball onto it from high up,
The springs are just going to snap.
exactly, it has to yield. It has to be able to stretch and recoil to dissipate all that kinetic energy. The sources actually refer to the relationship between the diaphragm and the pelvic floor as a dynamic piston system.
Meaning they travel in the same direction at the same time.
Yes, under optimal conditions anyway. When you inhale, your diaphragm physically drops downward to pull air into your lungs. That movement increases the pressure inside the soda can.
So the pelvic floor has to yield.
Right. It gently lengthens downward to accommodate that newly displaced pressure. Then, when you exhale, the diaphragm rises back up into the rib cage, and the pelvic floor naturally recoils and lifts back up to its resting state.
Okay, but that whole dynamic piston thing relies entirely on the sides of the can remaining stable, doesn't it?
Yes, it absolutely does.
So what happens when someone actively messes with the sides? Because the sources explicitly call out two incredibly common habits here: chest gripping and abdominal gripping.
Oh, those habits completely ruin the resting internal pressure.
Because chest gripping is essentially just chronic shallow breathing, right?
Yeah. When someone breathes solely into their upper chest, their diaphragm remains rigid. It fails to actually descend. And abdominal gripping is even more common. It's the habit of constantly sucking your stomach in to appear slimmer.
Which is basically squeezing the middle of the soda can all day long.
Exactly. And when you squeeze the middle of any pressurized cylinder, you displace the volume. You force all that internal pressure outward toward the weakest points.
The top and the bottom.
Right. The diaphragm gets stressed out, but more importantly, the pelvic floor is just put under this constant, unnatural downward strain.
So if you're an abdominal gripper, your pelvic muscles are already working overtime just to handle that artificial pressure.
Yes. And then you introduce a violent sneeze on top of all that. The pelvic floor is already stretched, it's fatigued, and it's totally robbed of its ability to act like that yielding trampoline.
So the springs just give out.
The springs give out.
Wow. And I guess this really explains why a sneeze is just the catalyst. I mean, we know it acts like a hammer blow, but why does this specific allergy season suddenly lead to someone experiencing stress urinary incontinence?
Or SUI, yeah.
Or even more severe issues like pelvic organ prolapse.
Yeah.
It's rarely just the sneeze, is it?
No, it requires a multifactorial breaking point. The body is remarkably resilient, and the research notes there are actually built-in redundancies in the pelvic floor.
Like backup systems.
Basically, if one muscle is slightly weakened, the adjacent fascia and muscles will compensate, but those structural insults accumulate over time. SUI affects up to 26% of women between the ages of 30 and 59.
That is a huge percentage.
It is. And that prevalence exists because the trampoline has been subjected to compounding variables that slowly degrade its elasticity over the years.
The clinical guidelines highlight a few mechanical factors here, like a BMI over 24 means extravisceral fat is physically resting on the pelvic cavity.
Which increases the continuous resting intra-abdominal pressure 24 hours a day.
Right. And previous pregnancies, those physically alter the anterior pelvic tilt, mechanically stretching those muscles for 9 months.
Before a sneeze ever even enters the equation.
Exactly. So the mechanical wear and tear makes total sense. But the sources dive deep into two specific biological vulnerabilities that completely shifted my perspective on this.
The first is a hormonal link driven by estrogen.
Right, because estrogen is heavily responsible for pelvic health at a deeply cellular level. The literature actually refers to it as a biological glue.
Biological glue, I like that.
It binds to receptors in the urethra and the bladder base. It stimulates blood flow and collagen synthesis. And this process maintains tissue elasticity, muscle mass, and critically, the plumpness of the urethral seal.
Which is the mucosal lining that creates that watertight closure, right?
Exactly. It's what keeps the seal tight against pressure.
So during perimenopause and menopause, when systemic estrogen levels just naturally plummet, that biological glue essentially dries up.
The cellular environment entirely changes. The tissues lose their resilience. The mucosal lining of the bladder and the urethra physically thins out. It becomes brittle.
So a sneeze that a person could easily absorb at age 30 might cause leakage at age 50, simply because the local tissue lacks that estrogen-fueled elasticity to maintain the seal under sudden pressure.
Wow. And then the second vulnerability outlined in the text is genetic. For people with hypermobility spectrum disorders or Ehlers-Danlos syndrome, their collagen is structurally different.
Connective tissue is just as important as muscle tone here. I mean, the pelvic organs aren't just magically hovering in place,
Right, they're suspended.
suspended by a whole network of ligaments and fascia, which are composed heavily of collagen. In conditions like EDS, the genetic coding for collagen production creates fibers that are just too elastic,
They stretch past their designated limits.
and they fail to snap back tightly.
So the trampoline springs are fundamentally loose from day one.
Yes. The muscles are forced to compensate for the failing ligaments, they get overworked, and eventually, under the acute pressure of a chronic allergy sneeze, the whole system just gives way.
Which brings us back to the allergies themselves, because the physical force of the sneeze is really only half of the equation presented in these medical texts.
It really is.
And I found this part of the physical therapy blogs completely counterintuitive. How does pollen directly hurt the bladder?
It's crazy, right?
It is. Like, we understand the mechanical pressure of the sneeze, sure, but the sources argue that the allergic reaction itself compromises the pelvic floor.
Yeah, it all comes down to the immune system's chemical messengers. When your body detects an allergen like grass pollen, it releases histamines as an immune response to fight off the invader.
And those histamines trigger the localized swelling, the itchy eyes, the runny nose.
Right. But histamines are systemic. They travel through your entire bloodstream.
And they eventually bind to receptors in the pelvis.
Exactly. They bind directly to mast cells embedded in the mucosal lining of the bladder. And this triggers a localized cascade of neurogenic inflammation.
Wow.
The histamines literally sensitize the nerves in the bladder wall, making the muscle highly irritable. This creates a sudden, really urgent need to urinate, often resulting in overactive bladder spasms.
So the bladder is already chemically irritated and contracting on its own, and then it gets hit with the massive mechanical force of a sneeze.
It's a terrible combination.
And that systemic chemical reaction completely changes the treatment approach, doesn't it?
Yeah.
Because how do we conventionally treat allergies? We take antihistamines.
Which is where it gets complicated.
All right. Because if we follow the biomechanical chain reaction here, the medication might actually be making the pelvic floor trauma worse.
It definitely can. Antihistamines work by blocking those histamine receptors, but a huge widespread side effect is systemic drying.
Right. They dry up your runny nose.
They dry out the mucous membranes in the nose, sure, but they also dry out the mucosal lining of your gastrointestinal tract.
Oh, no.
Yeah, this drastically slows down gut motility, which leads directly to constipation.
And chronic constipation is a massive mechanical risk factor for the pelvic floor.
Exactly. If the allergy medication is causing severe constipation, you are likely straining on the toilet. And straining is essentially a prolonged Valsalva maneuver.
Just bearing down with intense, sustained intra-abdominal pressure.
And that prolonged bearing down physically stretches the pudendal nerve, which supplies all the motor function to your pelvic floor muscles. It stretches the ligaments.
So wait, just to recap this cycle. The pollen triggers histamines that irritate the bladder nerves. The resulting sneeze hammers the pelvic floor with pressure. And then the antihistamine medication dries out the gut, causing straining that permanently weakens the support structures.
It is a closed loop of trauma.
That is wild. So if the allergy medication is creating secondary mechanical issues in the gut, we have to look at localizing the treatment.
Right.
To protect the base of the soda can, we really have to regulate the top of it. That means outsmarting the allergies and stopping the violent sneezing fits before the pressure spike even happens.
And context and timing are paramount here.
Yeah.
Today being June 19th places us in a pretty brutal meteorological overlap.
Oh, definitely.
According to the UK data in the sources, tree pollen season runs from March through September. But simultaneously, we are at the absolute zenith of grass pollen season, which spans May to July and affects roughly 90% of all hay fever sufferers.
So navigating that peak season requires actually understanding the pharmaceutical timelines from the NHS clinical guidelines. You can't just pop a pill the moment you feel a sneeze and expect it to magically protect your pelvic floor.
No, not at all. If you need immediate intervention to halt an acute sneezing attack, intranasal antihistamines are your fastest option.
The nasal sprays.
Right. They begin to act within about 15 minutes because they are applied directly to the affected mucosa. Oral, non-sedating antihistamines, your standard over-the-counter allergy pills, those take approximately a full hour to enter the bloodstream and take effect.
Meanwhile, the heavy artillery, the intranasal corticosteroids, they operate on an entirely different timeline.
Completely different. Corticosteroids are highly effective at reducing the baseline cellular inflammation, but they take up to 12 hours to show any clinical effect.
So they're strictly preventative.
Yes. You have to take them continuously throughout the season to lower the overall reactivity of the nasal membranes.
Hmm.
You can't use them reactively to stop a sneeze that's already happening.
Which brings us to the actual mechanics of using a nasal spray. Because the NHS Waltham Forest clinical guidelines highlight this highly specific detail about how to apply these sprays.
This is so important.
The instinctive technique that almost everyone uses is mechanically incorrect. It actively sabotages the medication. I mean, most people stick the nozzle straight up into the center of their nose, they spray, and they sniff backward as hard as humanly possible, right?
Until they taste that awful chemical drip in the back of their throat.
Yes.
But tasting the medication means it has entirely bypassed the nasal membranes where the allergic reaction is actually happening.
Oh, wow.
It's gone straight down your pharynx to be swallowed and totally destroyed by stomach acid,
So it's useless.
basically.
Oh.
Furthermore, aiming straight up directs the chemical spray right onto the nasal septum, the dividing wall of the nose.
Which is pretty delicate.
Very delicate. It has a fragile network of blood vessels. Blasting it with corticosteroids every day causes micro tears and chronic nosebleeds.
So the sources outline the clinically correct method to maximize the medication and protect the septum. It involves what they call a crossbody technique.
Right. The goal is to target the inflamed turbinates, which are located on the lateral walls of the nasal cavity.
The outside walls.
Exactly. First, you tilt your head slightly downward, not upward.
Okay, downward.
Then, use your right hand to spray into your left nostril.
Which naturally angles it away from the middle.
Yes. Using the opposite hand naturally points the nozzle away from the septum and directly toward the outside wall of the nose, which is exactly where those swollen turbinates are.
And then, crucially, when you dispense the spray, do not sniff aggressively.
Right. Sniffing hard creates too much velocity.
Just breathe in gently, then change hands. Use your left hand for your right nostril, aim toward the outside wall, and breathe gently.
Keeping the medication precisely on the turbinates maximizes the absorption, it stops the histamine cascade at the source, and it prevents the sneeze from ever forming.
It's such a minor biomechanical adjustment to your morning routine, but it drastically improves the local efficacy of the drug, which in turn spares the pelvic floor from those downstream pressure spikes.
Exactly.
But practically speaking, some sneezes will inevitably break through the chemical defenses, right?
Oh, for sure. You can't stop all of them.
So you need a physical bottom-up strategy to survive the pressure waves that do happen. Now, a really common reflex when someone feels a sneeze coming is to tightly cross their legs and just squeeze their thighs together in a panic.
Oh, yeah. But squeezing the thighs just fires the adductor muscles of the legs. It does absolutely nothing to adequately brace that deep levator anti-sling against a massive spike in intra-abdominal pressure.
So it's basically useless for the pelvic floor.
Completely. For actual anatomical protection, the physical therapy literature introduces this clinical neuromuscular concept known as the knack.
The neck, it's a technique for dynamic bracing, right?
Exactly. It's the practice of actively and intentionally contracting the pelvic floor muscles immediately before and during a sneeze, a cough, or a heavy lift.
So it relies entirely on anticipation.
Yes. By actively bracing the sling a split second before the sneeze hits, you pre-tension the muscles. You create a firm counterforce against that sudden downward wave of internal pressure.
You're basically neurologically overriding the body's natural delay.
Right, you beat the pressure wave to the punch.
But locating those deep muscles to perform the brace is notoriously difficult. I mean, they aren't externally visible.
No, it's very abstract for a lot of people.
So the sources provide these visualization techniques to help establish that mind-muscle connection. Now, a gentle, standard visualization is imagining you are pulling a blueberry up into your bladder or drawing a tampon further upward.
Which works for some.
It does. But one of the medical texts explicitly cites a highly unconventional, vividly startling method.
Oh, this one. It is a very polarizing metaphor in pelvic floor physical therapy, but it is undeniably effective.
Okay, quote, "Another less technical and more unconventional method of figuring out the pelvic floor muscles is to imagine sitting in a bath of eels and clenching the muscles to stop the eels getting into the vagina."
It's intense, right?
It sounds like something out of a horror film.
It really does. But the biomechanical value of that metaphor is brilliant.
How so?
Because many people, when told to perform a pelvic floor contraction, simply bear down, or they perform a static squeeze similar to just stopping the flow of urine. But the eel metaphor forces the brain to sequence two very specific actions simultaneously.
Closing and lifting.
Exactly. Closing the sphincters tightly and actively retracting the entire pelvic apparatus upward and inward, literally pulling away from the danger.
Which is that specific vector of force, the upward cranial lift, that is exactly what is required to counter the downward strike of intra-abdominal pressure from a sneeze.
You have to pull up to fight the pressure going down.
Yeah. Okay, so once you understand that required movement, the goal is to train the neck so it becomes a lightning-fast reflex.
Right. And training this requires a progressive overload of the nervous system. You don't just begin by trying to brace against a full-force allergy sneeze.
That would just end in failure.
Probably, yeah. The clinical progression starts small. You sit comfortably and intentionally lift the pelvic floor while making a long SSS sound.
Like a hissing sound, because vocalizing that specific sound creates a tiny controlled amount of intra-abdominal pressure.
Exactly. You are giving the pelvic floor a miniature pressure spike to practice lifting against.
Oh, that makes sense.
You perform that 10 times to build the baseline coordination. Then, you speed up the motor pattern. You do a fast, sharp pelvic lift while saying a quick SSS.
And then you increase the force.
Yes. You lift strongly while vocalizing the sound louder. You are methodically programming your central nervous system to associate an upward pelvic lift with any increase in torso pressure.
And once that baseline is established, you basically just integrate the dynamic brace into your daily mechanics.
All day long, you consciously lift the pelvic floor right before stepping heavily down a stair, prior to blowing your nose, or right before swinging a golf club.
Any activity that displaces internal volume downward becomes a trigger to brace.
Yes. And the sources also detail a fantastic behavioral training tool for this, called the leak and repeat method.
I thought this was so practical, it provides immediate neuromotor re-education, right?
Yeah. If you experience a leak during a specific everyday movement like, say, standing up from a low couch, you don't just ignore it and move on.
You immediately sit back down.
Right. You execute the exact same movement a second time, but actively engage the neck before shifting your weight.
So it forces the brain to rewrite the motor pattern for that specific activity in real time.
Exactly.
But what about the days when the grass pollen is simply overwhelming? Because if someone has been sneezing violently for 12 hours straight, their pelvic floor is likely just fatigued beyond the point of dynamic bracing.
Yeah, muscle fatigue is real. And that is when you manipulate gravity.
Oh, tell me more about that.
Gravity is the constant engine driving resting intra-abdominal pressure, right? So to alleviate it, you lie flat on your back and elevate your hips on a firm pillow or a foam wedge.
Oh, so you're reversing the angle.
Physically shifting the weight of the bladder, the uterus, and the bowels upward toward the diaphragm. It removes the continuous mechanical load from the pelvic sling.
Giving it a break.
Yes, allowing the stretched fascia to rest and all those local tissues to reperfuse with fresh blood.
Wow. When we synthesize all of this, the whole narrative completely changes. Chronic sneezing from allergies fundamentally wrecks the pelvic floor because it turns the human torso into a high-pressure piston.
A piston that repeatedly slams downward kinetic energy onto a U-shaped sling of muscles.
A sling that is likely already compromised by, well, the altered mechanics of a higher BMI, the structural stretching of past pregnancies,
Or a genetic predisposition to overly elastic collagen.
or even the cellular tissue thinning caused by drops in estrogen.
Right. The symptoms manifest locally at the base of the pelvis, but the root cause is entirely systemic. The pressure has to escape somewhere.
It always finds the weakest link. We want to remind you, the listener, that you do not have to just accept stress urinary incontinence as an inevitable, unavoidable penalty of spring allergies.
They really don't.
By outsmarting the chemical cascade at the top, utilizing that cross-body nasal spray technique to shut down the histamines at the turbinates, and by reinforcing the mechanical base with the anticipatory bracing of the neck, you can fundamentally regain control of your body's pressure cylinder.
Managing internal pressure requires both a pharmaceutical and a biomechanical strategy, for sure. But regaining that structural integrity is entirely achievable.
Which leaves us with a final, lingering thought for you to mull over today. Think back to that opening concept about how we treat the human body in these isolated, disconnected silos.
Right, the different hospital floors.
Exactly. If our bodies truly act as unified, tightly pressurized cylinders, where a microscopic piece of grass pollen tickling your upper respiratory tract directly and physically degrades the deep connective tissues at the absolute base of your spine.
Makes you wonder.
It does. What other seemingly disconnected everyday aches, pains, or mysterious physical symptoms are actually just trapped internal pressure, desperately trying to find an escape route through the weakest link in your anatomy?
Something to think about the next time you feel that pressure building in your sinuses.
Absolutely. Thanks for joining us on this deep dive. Stay healthy and remember the eels.